So we introduced the MyRisk inherited cancer panel testing into London at the end of last year. So we now have a relatively extensive experience with it in private cancer patients in London. And it has been incredibly popular since we brought it in. Since we introduced the MyRisk panel, we have done very, very few comprehensive BRCA tests at all. One of the main advantages of these panels seems to be that if you examine the sequence of all 25 genes and find that they are all normal, that has a major impact on the clinical care of the patient. Within the breast clinics in London now, a lady will be sent for a panel test. If the result comes back normal, she will just have the cancer on one side treated. If we find a pathogenic mutation, a true fault, in one of the breast ovarian cancer genes, that lady will consider having a bilateral mastectomy and also considering having her ovaries removed as an insurance policy after the age of 40. So the introduction of panel testing, at least in the London sector, has made a major difference to clinical care over the last year. I think this change in practice that has happened has been very much driven by the breast surgeons and by the breast oncologists in the private sector. They seem to be much more reassured to suggest that the lady does not have a bilateral mastectomy if she's had a 25 gene panel test and no mutations have been identified. And that, of course, is important not only in breast cancer and in looking at a bilateral mastectomy, but almost more important in the concept that some of these women are at high risk of developing ovarian cancer at some time in their lifetime and really need to consider prophylactic oophorectomy in order to prevent ovarian cancer developing later on.